All right, welcome back to Daybreak. We are remembering Ken Okoth, the fallen Member of Parliament for Kibra, and we do that by... He actually came to Daybreak on the 22nd of January, that is this year, just at the turn of the new year, and he, like the members of Parliament spoke, including this gentleman here, that he was passionate about education. That was his main focus that day, and he was speaking about Starehe. Remember that time there was a story about Starehe boys sent discriminating against the student who had to change school and go to Mangu school. So he spoke about it. Let's just listen in.
I grew up in Kibra. I got a sponsor through Starehe Boys Center, and it's changed my life. You know, and to this year, Starehe is celebrating 60 years. And that's something we have to be proud of. There is an injustice when you think a Starehe can do such a good job to transform the lives of somebody like me. But it's also so sad that there's only one Starehe. We need a Starehe in every county. And if people are so interested in this story of Starehe, and it's so, you know, Starehe remains relevant. Even if people say, oh, it's not as great as it used to be, it's not #1 as it used to be, there's a reason people feel a stake in Starehe in a special way that they don't feel for other places, because they know it's life-changing capacity and priority for boys from places with need, boys who are transformed into leadership and opportunity, who give back to society, and it's more than just academic success. And we need that opportunity, not just to the 280 boys who are accepted into Form 1 at Starehe. My message is we need a Starehe in every county, and we're thankful that there is one Starehe, but we need many more. And if we want to make Starehe relevant, make sure there's free secondary education, this capitation of 22,000, make it 50,000. Support the schools in a good way so that any child can go to a good government school.
All right, so you are in studio with him, Honorable Oluoch, Anthony Oluoch, and he's speaking passionately about we need a Starehe boys, a Starehe school in every county. We need to increase the capitation that goes to schools in as far as education is concerned. Do you think that these are wishes that will be achieved during our lifetime, or are we in a situation where the resources are so scarce to really devote more attention to education that affects the young people?
I think the unfortunate thing about this capitation issue is one that I think speaks to the question of discrimination and inequitable distribution. And it's something I think Magoha is now keen to try and address. I will tell you, for example, we were discussing issues of infrastructure funding. For the last financial year, we had 1.5 billion. You have one school that gets 70 million. You have another school that gets 1 million. That's a discussion we need to have. I think what Ken was trying to say that day is, one, the uniqueness of Starehe and the opportunities it has given for young people, people who are bright, coming from backgrounds like his, and the opportunities that it has given so that they are able to give back to society. I think when you're talking about infrastructure funding and capitation, schools like Starehe ought to have priority because of the transformational capacity it has in terms of the people and the students it chants into society. So I think that particular day what we were discussing was a question about these teachers and TSC dispute that there was between Starehe, and the fact that Starehe was refusing to play to the rules. I think eventually that issue was solved. Secondly, I just wanted to say on the issue of cancer itself, and I think Gladys Wanga has brought in a bill where I think she has tried to say that we need to amend the law so that we have primary caregivers, the first person you go to when you go to hospital, being able to deal with, diagnose, and give first help as a cancer patient. So I think this discussion is something that we ought to need. Lastly, on the issue of lifestyle, because we're talking here off air about how chemo, the devastating effect of chemo, and I think that's what really took Ken so fast, is that how do we deal with cancer at the different stages? I think past stage 3, going to stage 4, we simply have to come back about what are the alternative ways we need to, and that's where his bill comes into. We need to help this person to die with dignity. When you read articles 29 up to about 30-something, you find the right of the individual person to live with dignity, and you see the kind of suffering that people have to go through because of this chemo thing, just so that they can add 2 years. I think it's not, it doesn't lend itself to the life that the Constitution contemplates about the dignity of a human person.
Right.
And then, of course, we have to think about the lifestyles and the things we eat. We've heard about meat and the things that are injected in meat.
So, speaking of which, this is what that letter to National Member of Parliament, National Member of Speaker, rather, Justin Muturi said from him, Ken Okoth, and I quote, "The proposal bill seeks to ensure that there's regulation for growth and safe use of marijuana and hemp, including the registration of growers, off-growers, producers, manufacturers, and users with special focus on protection of children and minors from illicit use, just as we do with tobacco and alcohol." Do you see a time when that bill will be passed, given how expensive it is to treat cancer, and given the fact that he is a member of parliament or was a member of parliament for Kibra? You can imagine how many other people are living with cancer, but they don't have the monies to go to France like he did, come back and sort of get the medical attention that he's received.
It's a conversation, it's a very uncomfortable one, I believe, but one that we must have, if for no other reason, just to mitigate the suffering of cancer people. But I see another angle to it. Assuming, for example, we ourselves completely restrict its use. There are 33 countries, as Asian says this, that have legalized. How about we safely produce, package, and export to these 33 countries the marijuana?
Okay.
The economic impact and the effect that it will have on our economy would be huge. But I think it's a conversation we must begin to have.
Senator, in terms of how he, Ken Okoth, the late Ken Okoth, fought cancer very courageously, very bravely. He kept on letting us know what is happening, even at the time he was in France. What can we do, especially for when it comes to citizens in Kenya, when it comes to the cost of cancer?
I think the most important thing right now is to ensure there is serious public awareness about cancer all over this country. I come from a village where most of the cancer patients in Kenyatta are from a place called Uke in my village. And I was actually speaking on this cancer thing on Friday during when I was graduating students of a medical school in Meru. And the truth is that people are really suffering the cost of acquiring care, because I wouldn't say purely it's complete treatment. And I think if what I hear from the Mendix is anything to go by, and if cancer is diagnosed in the first stage, then can be managed. I think it's create awareness, let people know about it, let this country, we formulate and a law that created the National Cancer Institute. I don't know whether it's operational or not, and then also ask government to put in so much emphasis now, just like the way we did with HIV, because I believe cancer is worse than HIV right now, and put in a lot of resources to be able to manage those people that are suffering from this disease, cancer, and also ensure, as my brother here said, that educate people on how to live healthy, because I think even most of the cancer here is as a result of what we eat and where even what we eat is grown from, because because it's something with which at my level I'm not able to explain. But at the same time, let me challenge our professors and our researchers, because if, for example, as people are saying, there is some bit of rumor about marijuana probably having some bit of cure or relief on cancer patients. Any serious researcher, and I asked some of the university students, lecturers, who at times are on the streets making noise or arguing, other than writing proposals for funding, especially to research on these things. I think it's a time we also, as a nation, put in a lot of money on research, so that we support our intellectual minds that in the line of medicine to continually or take over this matter, because it requires urgent intervention. Lenvix
on Twitter, you're saying that if there's an MP that worked for what he was elected to do is Ken Okoth, other members of parliament should follow his footsteps, and he's specifically tagging Mithika Linturi, the senator of Meru. I don't know why, or maybe because
Let's say what you're saying.
Then Dr. Jeno Mwenga is saying that Honorable Ken Okoth is the true definition of a leader. He gave hope to the poor children of Kibra. All the MPs should emulate him and stop being greedy. So that's what they are saying.
I want to say something on this because
yes,
I sit in the health committee, and last week we met the Cancer Institute, and it shocked you that that body exists and there's no money that goes to it at all. They only have money to pay salaries for the last 3-4 years. It's shocking.
They've been requesting for money and no allocation.
No money is going to them. I mean, I joined the committee last month, and it tells you how our priorities are. That cancer is wiping out our people, but we're giving it a lot of lip service. No one is putting, and like Senator is saying, if cancer is such a beast, why can't we as a government say, this is what we're going to do in it? We're going to join the rest of the world in contributing in research in our own small way. Okay. Remember, this country has been at the forefront trying to get the HIV drug. Yeah. You know that.
So now that you know this, what do we do? Yeah,
this is what you're talking about last week, that we need to put resources in that institute and try to ensure that we are able to get the right way to deal with it, even as the whole world does this. Number 2, on this marijuana issue, I think marijuana is bastardized in a bad way, that we grow up from the day you become a human being and yourself, you're told bang is bad and all this. But if we know, or if it's, like he says, a rumor that it can help, then research must be done in that regard to ensure that things are done the right way. But something that I wanted to say about that clip of Ken and Starehe.
Right.
And Okoth and I are MPs, and this is what something I also do in my constituency. Most MPs try to get down so thin that you got 50 million shillings, instead of having one single project that is impactful, you want to spread this into 50 projects. Right. It will not help anybody. You can create another study or studies in every county if all of us agree that there is no point on building 2 classrooms in a school, but there's a bigger impact in having a single institution that can create that kind of an impact. Okay. Number 2 is access. Of course, talking about access, not just to school, but to mentorship. Because Strategy is about mentorship. I think we need to go into that field too. Mentoring. There's sharpness, there's brightness, intelligence, yes.
Are you able to do that in Ugenya?
No, I mean, this is about Okoth, so I will not want to talk about what I've achieved in my constituency, but you should check.
No, I'm asking about remembrance of Okoth implementing such kind of things.
Ask Ken. I'll not talk about myself. Ask, he knows what I do in my constituency. But the point is this, that we could achieve a lot in our lifetimes, but just by focusing on the right things.
What do you want to focus for the Ugenya people?
Oh my God. Like I've said, I don't want us to focus on Ugenya.
Okay, all right.
I mean, what you tell you what I'm doing. I mean, Ugenya is the only constituency in this country where in 4 years we build 4 colleges, tertiary institutions, 4 years. Okay. 1 per year using CDF just to help ensure that people are able to transition from secondary to tertiary institution. I mean, it's about Okoth, and I want to talk about what Okoth really wanted. Okay. And finally, before he comes in, something he talks about capitation and just access. We've got so many children in this country today, sharp. The only thing they lack is capacity to access this. Okoth says that his eyes got bad because of reading using a koroboy. Yes, and he says there are times when he could not go to school. He says he had to sit exams twice, thrice. Access. So we can build so many Arors and Kimwarers, but if you cannot put money in education and ensure that if you say it's going to be free primary, it's free. If you say it's free secondary, it's free. Okay. It'll shock you. MPs will tell you today that when you wake up in the morning, you got 13, 15 messages. Even when I leave this studio, I'm going to have like 20 of them asking for school fees. Why?
They need support.
It's a big problem that we must address, and in honor of Okoth, in my opinion, if the government was serious, and I've had President, Deputy Raila Amolo Odinga talking about Okoth's legacy, make free primary and free secondary education free indeed.
Free indeed. And finally, as we close on this conversation about Ken Okoth, Osiani, maybe your final thoughts on this.
No, foremost, we talked about creating awareness. And once the country is aware, because the moment we declare that cancer is a national disaster, as we did with HIV, it forced people to go and find out whether they were sick. When we have created awareness, we will push people to go and find out if there's a problem. But the trouble with our country is that diagnosis is such a mess. So you will go through it, you will be diagnosed with all the wrong things. We do not have capacity in most of our medical institutions, you know, to try and figure and diagnose correctly what's happening. I remember, I mean, and this would be sad to mention, but I remember former Governor Isaac Ruto, when he lost his daughter, he said, you know, I took my daughter to hospital. They diagnosed all the wrong things in one of the leading hospitals in this country, only for me to later find out at the tail end what the real problem was. So if we put emphasis on diagnosis, and that lends to what David had said earlier, that we need to put money into this National Cancer Institute, then we will get the necessary equipment to help with diagnosis. Now, to what Ken had been doing in education, it is good. You lend someone, you give someone an opportunity for education, you have armored them for life. Then we move to the crisis of what after education, because we have so many people in this country that are educated.
Okay.
And education, people must know, ought to equip us to be innovative and create solutions. And you need to agree with the fact that when you are going through school, the tragedy of our education is that it has made us to look up to employment. And I recently saw the CS for Youth and Public Service, Madam Margaret Kobia, saying young people need to start creating jobs. And someone took on her and said, Madam, you've been employed for 37 years. True. You should be creating jobs. Then you tell us, I created my factory. Yes, yes. I now employ people. But so long as you have moved, you know, went to Kenya School of Government as a director, moved to the Public Service Commission as chair, now you are employed. And a member of parliament in Tanzania said, what are we here talking about? Young people create jobs, and yet we, members of parliament, went to seek a job opportunity from the electorate so that we can be employed. Now, the government must innovatively, even those who are armored with education, to think and create solutions, must know that any person who seeks to employ you will be seeking to employ someone who creates a solution. So to honor Ken Okoth, give these people an opportunity for free secondary education. Kenyans are poor. And after that, create opportunities that will absorb our young people in different sectors. Those who go through tertiary and polytechnics, tertiary colleges, because Ken wanted a polytechnic in Kibra. And I hope that whoever takes over from him achieves that vision.
With that.
Then, after that, channel them to useful income earning.